My next guest could emerge as the dark horse in the Massachusetts governor's race. He has a high-powered resume, including a stint running both Medicare and Medicaid for the Obama administration. He's also making some bold campaign promises like eliminating child poverty in the next decade. I'm talking about Democrat Don Berwick. He's a non-practicing pediatrician and former CEO who is one of 5 candidates seeking the Democratic nomination. Welcome, Don. Good to have you.
Thanks for having me here.
So, yeah, you spent a lot of time with the Obama administration, I said, working Medicare, Medicaid. You'd like to bring a single-payer health care system here to Massachusetts. There's so much resistance to that. I think Vermont might have it, but people balk at that.
Times are changing. We need to make health care much more responsive to our communities, better care, better health, and lower cost altogether. We know how to do that. I've spent 30 years working on that. So we need to make the system more focused on the needs of patients, but also simplify the payment side. We're hideously complex. The payment system confuses us. It confuses the doctors, the nurses, the patients. A single-payer system, Medicare for all, would have lower overhead costs and would give us a chance to speak out more on behalf of patients instead of being in this confusing insurance scheme.
Odd loyalty to their insurance companies, and they think this is the long arm of government reaching in and taking it away.
Not the people I'm meeting. I'm out on the campaign trail, and there's a lot of people who are they're aware of this serious complexity and the waste that it involves. I ran Medicare and Medicaid for President Obama for 17 months. My overhead rate in running that program was 1% of the amount of money spent on health care we had to spend on administration. For an average insurance company in Massachusetts, in part of the market, it's 10%. For many, it's 15, 18, 20%, and that's waste. That's paperwork, that's shuffling papers, and it doesn't give us a chance to really speak on behalf of patients and families, which is what I think one of the advantages of a simpler system.
All right, that's one ambitious effort on your plate, and the other, as I mentioned, eliminating child poverty. I mean, what does that mean? Because as children are born into poverty, their parents are poor. How do you eliminate child poverty?
Look, we're a wealthy state, wealthy in our resources, but also in our ideas, our compassion, the willingness to work together. Why would we have poverty as accepted as inevitable in this state? I come from an era, remember the war on poverty. We need it back. Poverty hurts everybody. It of course hurts the people who are suffering under very low incomes, on inability to make ends meet, inability to have a roof over their heads, for Pete's sake. But then it hurts the rest of us. Someone who's poor, they can't be a good customer, they can't be a good employee. So we need to work on this. Now, I think it's possible. I think if we set our minds to a bold goal here of really eliminating poverty in children, we can do it. I've worked around the world, on improvement. I've worked in New Zealand, for example, which actually has that goal. For the past 4 or 5 years, they've been working on the elimination of child poverty. They do it by real teamwork at the community level and being very bold about what they're trying to get done. And I think we could do it here, and I would love to lead that. In fact, I'd love to lead that personally. If I were governor, this would be a day-to-day endeavor for me.
Maybe if you're not governor, somebody will hire you to do that. Similarly, you want to eliminate homelessness. Now, this is even more complex in some ways because it involves adults. Not every single one of those people wants a home. They don't want you telling them where to go. You want to get them off the street, but that's not necessarily their goal.
Most do. We have several levels of kinds of inability to get housing. There's chronically homeless people, a couple of thousand in this state. They sleep on the streets, and they don't need to. We know how to eliminate chronic homelessness. There are programs, again, around the country that have done it. It's surrounding the person with the resources they need. Help from mental health, from the healthcare system, from housing, from transportation, from corrections. If we do that, we can make it zero. And then there are a whole bunch of people who are just, they're really in trouble. They cannot afford housing. I met a man, Mr. Gibbs, just a couple of weeks ago. I mean, he has 4 kids, himself and his partner. They're in a motel room right now, one room with a family of 6, and that's costing the Commonwealth $4,000 a month. If we could really reinvest in the housing voucher program for $1,200 or $1,300 a month, we could give this man dignity. He would have a chance to get back into society. That's what he wants, and we could aim for zero.
You seem like a really nice guy, very well informed, up on the issues. Tell people why they should vote for you. What is it that you're bringing to the table?
Well, I worked in Washington for that 17 months, and I was excited by being reminded again what good government can do when it really is focused on the needs of people, and when ideas like social justice and compassion and equality are core to what we're doing in policy. But I also see the country headed in the wrong direction now. More and more unequal, less able to talk about these issues, about the fabric of our communities. Massachusetts is different. This place can be a beacon for the nation with a progressive agenda successfully executed, an agenda in which government does do the right thing with all of us to help us have a society characterized by those by what we want, justice, equality. I'm very anxious to make this an example for the nation.
All right, Don Berwick, pleasure to have you here.
Thank you very much.